Black men, we stand tall, we lead, we protect, we show up for our families, our communities, our people. But when it comes to our own health, too many of us stay quiet. And that silence, it's costing lives. Here's the truth. African American men are twice as likely to die from prostate cancer. Twice. But listen, when caught early, it's 98% treatable. That means getting checked isn't just about you. It's about being there for the ones who need you most. Fellas, if you're 45 or older or have a family history, it's time. The exam is fast, simple, and it could save your life. Strength isn't just in what we do, it's in the choices we make. Don't wait. Take control of your health today.
Breast cancer affects millions of women in the United States as the second leading cause of cancer-related deaths. Black women are especially at risk of developing and dying from breast cancer compared to women of other races. Early detection can improve treatment outcomes and save lives. Mammograms are a powerful tool in the detection and fight against breast cancer. A mammogram is a quick X-ray that can identify abnormalities in the breasts long before they can be physically felt. Every woman aged 40 years and older is entitled to a free mammogram under the Affordable Care Act every year. Make mammograms a priority in your healthcare routine. It's a small step that can have a huge impact on your health. Let's work together to empower women.
Yes, thank you, and I'm very happy to be here. You guys have all been working in your jobs for years and years and years. I've been secretary for 3 months, so there's a disproportion there. What things can I say? I'll try to be quick so people have time to say what they need to say. I've been working as a physician in Massachusetts since 2003. And my first life in Massachusetts was working in Lawrence. Entonces, estoy todavía aprendiendo a hablar español. Yo puedo contestar algunas preguntas en español, pero claro que hay cosas que yo no tengo el vocabulario para hablar sobre cosas muy complicadas. Para mis pacientes es suficiente, pero no para usted. And the reason I actually learned Spanish is that whenever I would walk into the room, people would get really excited because I look Dominican, right? So people get really excited and start talking really fast in Spanish, and I'd be like, lo siento, parezco dominicano, pero no soy. That was my first sentence that I learned. And so I still see patients in Lynn. I was trained as a primary care doctor, but over the last 15 years, mostly I've been mixing addiction medicine, particularly opioid addiction treatment with my primary care. I have 2 adult children, and I'm married to a German woman, so both my kids actually now live in Germany. What more can I say? For Yves,
Donc, je parle français.
Donc, je parle français. Oui, j'ai grandi au Congo, donc je peux parler français. Malheureusement, mais malheureusement, je ne peux pas parler créole. So, I'm very excited to be secretary. I think one of my main goals throughout my career has really been to serve people who are most vulnerable and to figure out how to bring resources and power into communities that have been disenfranchised for a long time. And I see that my work as either a teacher or a physician or now as a health policy advocate, I really see that fitting within that role. And I must also say, it flows very well. I have a great team that I work with, and so I think I'll turn it over first to Christina.
Hi everybody, great to be here. Cristina Aguilera Sandoval, I'm the Executive Director of the Office for Refugees and Immigrants of the state, an agency of Health and Human Services. And as you can imagine, we have been very busy, as every agency of the state, with all the changes that have been happening on immigration. But we also early on really prepared to kind of meet the demands of the moment by informing our community broad and wide on not only their rights, which is something that we've done in partnership with so many of you and with so many of the community-based organizations, but also to make sure that we create programs that can truly support the needs of our communities where they're at. At the Office for Refugees and Immigrants, our goal and mission is to welcome and empower all immigrants in Massachusetts and refugees to ensure that they have access to the resources of the state and the resources that are out there through the community, through community-based organizations, many of them providers of programs through our agency. And in these times, I wanted to highlight a couple of programs that I think are important to have all of you as communicators of them, because we want we've been doing regional convenings all over the state and have gone to so many communities that have been really impacted by the indiscriminate enforcement of immigration these days that is really hurting our communities. And I think the message has been loud and clear that our secretary, our governor, our agency, and statewide, our government is really committed to supporting and protecting immigrants in this really harsh situation by putting out information and resources. And so a couple of programs. One that is extremely exciting and it launched yesterday is the Massachusetts Access to Counsel initiative. And with that program, community members will be able to reach out when they are in detention or removal proceedings to receive legal services. And the most beautiful part of this is that these legal services are not by hiring the same immigration attorneys that are currently full of caseloads, but by adding to the space of immigration legal services 24 new attorneys that will be trained and mentored to be able to receive all of these new cases and support. So this is an expansion of immigration attorney that, as many of you know, are not enough in Massachusetts and all over the country, that is going to greatly benefit our communities. The second one is the YVES project. It's a project that allows individuals that are being detained to contact one of our program coordinators when they need to be matched with an attorney that can file in court, in federal court, this YVES, so that they are not transferred outside of Massachusetts when there is an unjust detention. And it has to be done in the first 24 hours as fast as possible, and we've been able to be a model in the nation on this program to replicate in other states so that we can continue to support families to keep their relatives in Massachusetts so that they can have a fair bond hearing and support. In partnership with the Attorney General's office, we also have a legal representation fund for individuals that need to have legal support for bond hearing and that are low income. And we'll be sharing through Valentina and others some of these resources, but we've been putting it out there in the community to make sure that they're connected with this. And we also develop a resource toolkit that is on our website. If you go to mass.gov and you look for community resource toolkit under the ORI website, you'll find kind of a combination of all the incredible programs that DPH and DTA and DCF, like all the different agencies, including HLC outside of the Secretariat, have available for individuals that are either the kind of families left behind after this enforcement that might be eligible for a new type of benefit, or something very simple and incredible like the family resource centers that are spread all over the state and are led by the Department of Children and Families, and where anyone, regardless of their immigration status, can go and receive some support, whether it is in goods and services like diapers or formula or other things, or car seats and other type of needs that families might have. So I'll make sure to share information so that we can continue this communication and spread resources and tools for families as broad as we can.
And for Christina, her communications person is Fabiano, who's over there in the corner. So I'll just be sure to introduce yourselves to Fabiano so you can get all that information that Christina was saying, and there's some of that information in the one pager that you can find in front of you. And I'm now going to pass it to Commissioner Robbie.
Great, thank you. Good afternoon, everyone. I'm Robbie Goldstein. I'm the Commissioner at the Department of Public Health. Just a little bit about me. I'm an infectious disease physician by training, but I've been here with the state for the past 2.5 years. I joined in April of 2023 as the Commissioner of DPH. And the Department of Public Health is a member of the Executive Office of Health and Human Services, one of the 11 agencies within the Executive Office. We note that we have kind of a unique role within the Executive Office. We have to think about all 7.1 million people across Massachusetts. We don't administer programs just for one particular population, but we think about people from birth to death and every day in between. And so we think really broadly in how our programs can have an impact in communities across the state. I think I'm specifically supposed to talk about vaccines, so I was going to walk you through a little bit of what we've done over the past few months with regards to vaccines. And I'll start by saying that a lot of the action that we've taken as a state is because there's significant uncertainty about vaccines in this moment. I don't mean uncertainty about the benefit of vaccines or the uncertainty about the safety of vaccines. Vaccines are safe, vaccines are effective, but uncertainty about the policies around vaccines. A lot of that has been because of the federal government and changes in the federal administration. Because of lack of action at the federal level, sometimes because of specific actions at the federal level, we have had to react here in Massachusetts. Our reactions are oftentimes trying to counteract mis and disinformation. I think folks have heard the federal Secretary of Health and Human Services, not the one we have at the state, who is an excellent physician and secretary, but the federal Health and Human Services Secretary has called into doubt the efficacy of vaccines, has questioned the safety of vaccines, and has oftentimes done that absent any data, any evidence, any supporting documentation. And that has really made our jobs challenging at the Department of Public Health. And so really going into the end of the summer, as we entered the respiratory virus season, we knew that we had to act. We had to act definitively. So we took a few actions as a state to guarantee vaccine access to everyone in Massachusetts. The first thing that we did at the direction of the governor was to put out a standing order so that every pharmacist, every pharmacy across Massachusetts could administer COVID vaccines to those who wanted a COVID vaccine. This allowed the pharmacists to have the liability protections that they would need to get the vaccines. It would give people the comfort, people in communities, the comfort to know that they could walk into their local pharmacy and get a COVID vaccine if they wanted it. We also had to do some work around pharmacy practices, or Board of Registration in Pharmacy put out new guidance and new regulation that allows pharmacists to administer vaccines that are recommended by the Department of Public Health. The second thing that we did is we worked really closely with the Division of Insurance, and just at the beginning of September, we put out joint guidance with the Division of Insurance that requires all Massachusetts-based health insurance products to cover vaccines as recommended by the Department of Public Health. We got collaboration from our friends at Mass Health, at the Connector, at the group insurance company as well, so that most people in Massachusetts will have insurance coverage for their vaccine. If they go into a pharmacy, they're not going to have to pay anything out of pocket to get a COVID vaccine. The third thing that we did is that we wanted to put out Massachusetts-based, evidence-based recommendations on vaccines, and in particular on the COVID vaccine. And to do this, we worked in close collaboration with our colleagues across the Northeast through a newly formed organization called the Northeast Public Health Collaborative. That's a collection of state health officials from Maryland up to Maine and everything in between, where we came together, we looked at the data around vaccine safety and effectiveness. We collectively worked together on how we could make evidence-based recommendations. We talk to professional societies like the American Academy of Pediatrics and the American Association of Family Physicians. And in early September, we put out universal recommendations for the Northeast. Those recommendations for COVID are that everyone 6 months and older is eligible for a COVID vaccine here in Massachusetts and across the Northeast. We put a particular emphasis on getting vaccines to those who are most vulnerable. The folks that are most vulnerable are those who are 65 and older, newborns who are 6 months to 2 years of age, and people of any age that have an underlying condition that might put them at increased risk. So things like diabetes and lung disease, people who maybe have heart disease, those folks, we really are recommending that they get out and get vaccinated. I would be remiss if I didn't say we also put out recommendations around flu. Everyone 6 months and older is recommended to get a flu shot. And we're doing everything we can to get the message out that people should go get vaccinated. Right? Folks should roll up their sleeves. We have someone here, right here, who went and got vaccinated. Was there when he got vaccinated at the Greater Lawrence Family Health Center. Thank you for doing it. Both at the same time. It's very brave. Right? But we really want to get the message out. Now is the time to get vaccinated. Folks should get to a pharmacy, to a community health center, to a local board of health, to their pediatrician's office or their primary care office, roll up their sleeve and get vaccinated. This is the moment, right? Right now, end of November, beginning of December, where we want to see the numbers really high. We're anticipating flu activity to start to increase over the next few weeks. We expect to see COVID activity to increase a little bit after that. Vaccination is going to build that wall of protection that we need so that people remain safe, communities remain safe, our healthcare system can be safe. So we really want to get folks vaccinated. The last thing I'll say with my comments is that in all of these actions that we took at the end of the summer going into the fall, there was also a commitment to continue to do this work going forward. So we're not just focused on respiratory viruses, COVID and flu, we're also focused on all of the vaccines that children receive as they grow up. Measles, mumps, rubella, chickenpox, hepatitis B, polio. We're going to use the same process, relying on the data and the evidence, working in close collaboration with our colleagues across the Northeast, and then communicating, we hope, transparently to communities so that they know what the right thing to do is for themselves, their child, and their community.
And we know in this year, we have been receiving a lot of changes from the federal government, so that's why we brought others from the Health Connector and Michael from DTA. So I'll send you others about.
Great. Hi everybody, it's great to see you all. My name is Audrey Gasteyer. I am the Executive Director of the Massachusetts Health Connector. And what we are is the state's official health insurance marketplace or exchange. And that means we're where anybody who doesn't already have health coverage, whether that's through a job or another program like Mass Health or Medicare, can come and get health insurance coverage. Right now we cover about 400,000 people across the Commonwealth, and we are in open enrollment period right now. So I'll share some key information that I will say to anybody who puts a camera in front of me or is writing an article, really important call to action information for the public to be aware of since we're in open enrollment, and then I'll say a few remarks about some changes that are happening as a result of federal policy. So open enrollment is the time of year when anybody who doesn't already have health coverage can come and sign up for coverage through the Massachusetts Health Connector. We opened open enrollment on November 1st. It runs through January 23rd. But December 23rd is a really important date for people to keep in mind because it's the date by which people need to have picked a plan and made a payment if they want coverage starting January 1st, for them to start out the new year with the peace of mind that comes with health coverage. So this is a really high activity period for us. We're out around the state talking to communities, making sure people understand this is the time if you don't have coverage to come in and get insured. It's important for people to be aware that most individuals who sign up for coverage through the Health Connector qualify for financial assistance to lower the cost of health coverage. So for people out there who might be uninsured and thinking they may not be able to afford it, really important they understand we have both federal and state subsidies in play to make coverage affordable. So it's the time of year when anybody can come in who's not already covered. It's also a really important time of year for people who are already covered by the Health Connector to come in, update their information, see if they want to stick with the plan they're already in or make a change. This is the time of year to do that. It's really important that people keep their information updated. If they've had a baby, they got married, their income changed, so we can make sure they're getting the best benefit possible. So that's open enrollment. We have all sorts of supports available, a fully staffed call center. People can reach out to us at 877-MA-ENROLL. And importantly, we have a network of what are called navigators, which are trained individuals in community-based organizations all across the state. They're community health centers, community-based organizations. Our navigators speak 30 different languages. They are wonderful resources. People can reach out to them, set up appointments, and get in-person assistance, either with the process of signing up for health coverage or maintaining their coverage and navigating different choices during the open enrollment period. So that's open enrollment. Importantly, it's important for people to understand there have been some federal policy changes that will affect how this open enrollment looks and feels to certain individuals across Massachusetts. So there's two big categories. One is as a result of the so-called One Big Beautiful Bill Act that was signed into law by the President in July. There are categories of lawfully present immigrants in Massachusetts and across the country who are losing eligibility for Affordable Care Act premium tax credits. What does that translate to here in Massachusetts? Individuals who are under the poverty level, who have been previously qualifying for Affordable Care Act subsidies and therefore our Connector Care program, our affordability program, people who are under the poverty level and these are primarily people who haven't yet met their 5-year bar for Medicaid eligibility, are no longer qualifying for subsidized coverage. So there's about 37,000 people who've been in this type of coverage during the course of 2025 who will no longer have that eligibility starting on January 1st. So we are communicating with that population to let them know about that change. There's two important messages for that population. One is, if anything has changed for them that makes their income a bit higher, for example, it's really important they're updating their account information. The income threshold we're talking about here is about $15,000 a year for an individual. So if somebody's picked up a second shift and they're earning a little bit more money, we want to make sure that that's in their account in the system with us, because it may bump them into a new category of eligibility so that they can maintain that subsidized coverage. The other important piece of information for this population is if they are losing Connector Care, they can and should still continue to access healthcare services at community health centers and hospitals supported by the health safety net. So we don't want people to stop accessing care. We obviously want people in coverage when possible, but it's important people understand they can still continue to access care through the health safety net. So that's one important change that's very unfortunate, and we continue to advocate for that population and hoping to see restoration of those supports that we're so displeased to see the federal government walking away from. There's another group of people that will experience some premium increases this open enrollment as a result of the fact that the federal government has not yet extended what are called enhanced premium tax credits. For the last several years, Affordable Care Act subsidies have been at a more generous level than they were prior to 2021. You might have all seen in news and obviously in the national political conversation as part of the federal government shutdown and negotiations around that, that Congress has not chosen to extend those beyond December 31st of this year. So we don't yet know if there will be any change there, but we are proceeding this open enrollment period with the expectation that they are not. So that does mean that there are a number of people here in Massachusetts who are seeing premium increases. So we're working to make sure those individuals do remain covered. They understand that they can shop around for different options through the Health Connector, because we want everybody to stay covered and continue to have the peace of mind that comes with health coverage and the healthcare access and financial security that comes with that. So I will leave it there and happy to take any questions later about those changes or anything else about open enrollment.
Hi everyone, I'm Michael Cole. I'm the Acting Commissioner at the Department of Transitional Assistance. We administer SNAP and TFTC EADC assistance programs in the community. I've been the Acting Commissioner, I think, probably just a couple months now, but as I mentioned, I've been with DTA since 2014. Hablo español, so a veces cuando estoy en una oficina y una persona visita, yo puedo ayudar un poquito con familias o personas que visiten las oficinas. And for those of you who speak Hindi, may Hindi samajhta ho thodi as well. I mentioned that because I think it's important, not only from the top, but all the way throughout DTA, from our caseworkers all the way to the leadership above, really value and emphasize multicultural diversity, serving the communities across the Commonwealth. Obviously, we serve more than 1 million people each month who receive benefits from DTA in some sort of a way across all communities, and we have 21 local offices that are in and around those communities. And really, each of those offices are designed and expected to serve the communities in that area in the way that those communities need. So if you walk into any one of those 21 offices, you're going to find, most likely, you're going to certainly find 2, 3, or more people who speak multiple languages. We hire for those, so the first person you come in is likely to speak your language, or you speak English or any other language. If not, we have translation services, so we're able to serve everyone. I think, just most important thing is recognizing that each of the communities we serve have their own needs, have their own makeup, have their own cultures, have their own dynamics, and yes, we have a level of standard expectation across offices, how we serve people, but we also encourage and intentionally design our office communities to be reflective of those that they serve. That includes hiring our staff. I think the agency exceeds expectations in terms of organization, the diversity of our staff, the languages we speak, where people come from. A large number of our own staff have been on benefits or received benefits at one point in their lifetimes, and that's really important because that lived experience translates into a more human experience for those who are coming in at a very difficult time needing supports. We need to do that human way. I think it's important to mention I think I'll start here now and say thank you for the roles that you're filling, whether you're doing it on a volunteer basis, you're more established, larger organization. As we saw over the past few weeks with the SNAP shutdown, we were able to do a lot of communication proactive to the people that we serve. We were able to do a lot of proactive communication to our staff, so they were ready to answer questions, whether it was on the phone or in local offices. We put up a website with sort of real-time, actual information and accurate information. But the biggest impact we saw were from the media outlets who were reporting the real, accurate news. I think a lot of people were getting nervous through social media, the rumors, things that they were hearing and seeing from friends and family, but being able to get out the actual information about what was happening in real time and was changing quickly meant that we were able to prepare recipients for what was happening, what to expect, when to expect their benefits, and keep them updated in real time. So thank you for that partnership. In addition to sort of getting over that big hurdle of the SNAP shutdown and the pause on SNAP, we're resuming now in full. We are one of the states who, on the very early end, were able to get full benefits issued out to our clients as quickly as possible, as soon as we saw a window to do that. And there are states that took a little bit longer, and there are some states now who are still trying to do that. So we're proud of that effort. But we're still reconciling with some changes through House Resolution 1 bill signed back in July 4th, also known as the Big Beautiful Bill, or OB3, that limits ongoing eligibility for a number of people. It expands work requirements for SNAP recipients, so now it expands to age 55 up to 64 are required to work, only 80 hours work or volunteer a month to be able to maintain their SNAP benefits. It also, for the first time, makes parents, families with children work required when their children reach age 14 or older, and those are new changes. We estimate around 99,000 existing individuals on our caseload will be impacted by these work requirement changes that, of course, will take place throughout the course of the year as we meet with these individuals and families. We'll be working with them to see how we can support them to meet those work requirements, to see if we can identify any allowable exemptions that
I would say that the majority of folks, and Robbie probably has the data, still get their vaccinations from sources like community health centers, their primary care pediatrician. And I would say that the area of Roxbury is decently well served in terms of community health centers, and we do a lot to support the community health centers. In terms of pharmacy and data, I'll turn to Dr. Goldstein to see if he has more detailed perspective on that.
Yeah, I think pharmacy deserts are a reality across many urban areas in Massachusetts. Boston, I think, is being hit particularly hard. And I think, as the Secretary noted, we're looking for other ways to get vaccines out. So community health centers are a great way to do that. What I didn't mention is that we also put out a standing order for local boards of health, including the Boston Public Health Commission, so that local boards of health can get out into communities and get vaccines, whether it be through a big event that they throw at a community organization or a van that they bring into the neighborhood to get the vaccines out. But I will just note that pharmacies are much more than vaccines, and they're much more than prescriptions. They're also a place where people get their blood pressure checked. They're a place where you have a trusted healthcare provider that you can talk to. There's a lot of benefits to having pharmacies, and I'm in close dialogue with Commissioner Ojikutu in Boston about the pharmacy deserts that are forming across Boston, in particular in Roxbury, Mattapan, in the areas that need that type of healthcare. So I think more to come on this story. I think there's work that needs to be done to get a strong pharmacy network across the state.
And how does Urban Heat tap in with you all so that we can help to share that story?
Yeah, I mean, I'd love to come on and we can talk about it. We can talk about the benefits of pharmacies. We can talk about the alternatives to pharmacies in areas where pharmacies don't exist, so that we can at least give people resources and access. Community health centers are one of them, but there are other ways that we can get resources into those parts of Boston.
Thank you. Thank you.
The biggest concentration of Portuguese in the state are in the South Coast, and there's specific medical related illnesses or issues related to that specific population, according to hospitals and doctors in the area. And I think we struggle with people call us what to do, like drug abuse, like pills and alcohol and others. Like they struggle where can they get help and even information to family or those individuals, where do you send them and where they can go. Does the state have any programs, any education programs or any campaigns to address that? Also, it's specific issues like diabetes, cholesterol, are high in the Portuguese population, just like heart disease. And also information, education specific to that population would be beneficial. And are there any programs or any campaigns or anything to address that?
So I think that between Robbie and I, there's probably a huge amount of knowledge that we're missing to answer your particular question. But I would say that the first message I would emphasize when people talk about addiction, whether it's alcohol or cocaine or heroin, number one is that it is a medical illness, right? So when you're thinking of seeking for help, your first instinct should be, what kind of health care can I access for my family member, for myself? So that's like the first thing. The first place you should go to is healthcare related resources. Number two, the Bureau of Substance Addiction Services, which falls under DPH, does have a very comprehensive website where you can go and it actually lists places where you can receive treatment. And you can put it by zip code, you can put it, so it's a very user-friendly way of getting that information. The other advantage that we have here in Massachusetts is that our insurance programs are required to pay for that treatment. So for instance, if you have Mass Health, you actually have access to a very wide variety of treatments, both inpatient, outpatient, in between, where you're able to access that kind of care. In regards to specific services, either Dr. Goldstein knows or we'll have to get back to you in terms of like, do we have anything in the Brockton, New Bedford area that's specific for chronic disease management?
I think we can get back to you on specifics, but maybe I'll just raise two programs, areas to watch, and areas where I think there's probably a story to tell over the coming year. One is to think about where the opioid settlement dollars are going. So for folks know, when now Governor Maura Healey was Attorney General and sued the manufacturers of the opiates, we received a significant amount of settlement dollars. Those dollars are being put back out into the community, in particular the Mosaic grants, which are being administered through RISE, which is a statewide organization, are going into communities and specifically trying to address behavioral health concerns, opioid-related concerns in communities of color, communities that speak languages other than English. And so I think there's a lot that we could probably get you details on organizations that are funded through the Mosaic grants. The second initiative to maybe call to everyone's attention is Governor Healey, when she came into office, and when now Secretary Mahania was Undersecretary, put forward the Advancing Health Equity in Massachusetts initiative, which is a statewide initiative to improve health outcomes and in particular to address health equity in those outcomes. And there are two areas of focus. One is to focus on maternal-child health, but the second is to focus on cardiometabolic disease and the social drivers of cardiometabolic disease, the things in our environment that result in heart disease and stroke and high blood pressure. And we've chosen communities across Massachusetts that I think would be relevant to a lot of the listeners and readers of your news. It includes New Bedford and Fall River, it includes Brockton and other areas in the South Shore and the South Coast. We are partnering with community organizations to get the work done. We're partnering with local folks who understand the needs of the residents, and we're trying to get out programs and ideas that are really going to improve the lives of the people that are there. And so I think there's still a story being written on that, but it's something to maybe pay attention to in the future and that the readers might be interested in.
On the go and feeling hungry? Everywhere you look, donuts, pizza, chips, soda. Tempting, right? But is it really the best choice? These foods may taste good, but they don't give your body what it needs. That's because they're loaded with salt, fat, and sugar, things our brains naturally desire. But here's the catch. Food companies pack in extra amounts and use smart ads to keep you coming back for more. You don't have to fall for it. Next time, grab a juicy fruit, a nutritious snack bar, or crunchy veggies with dip. With time, you'll see you don't need junk to feel satisfied. Real food fuels a real, healthier you. Make the smart choice. Choose nutritious food.